The structure that we were planning on at this point, and I say we because there is a patient who is willing to come, and I'm also standing as a representative of the clinic. So there's 6 people within our clinic, some of them a few family medicine doctors, a psychiatric nurse practitioner, social workers, and licensed professional mental health counselors. So we're a multidisciplinary team. And so what I'd like to share about is one, a little bit about the history of ketamine and just where it's been and its known pharmacologic effects, the sort of very even smaller history of it being used as a psychedelic medicine, and then talk about what's been happening in the recent published literature in terms of, okay, now there's larger studies out there and there's some publications in terms of what's going on and using it as the psychedelic therapy, because ketamine sort of has these 2 paths. It has a very well-established pharmaceutical path, and then this psychedelic assisted therapy agent is just getting evidence going out there. So I'm going to talk about that a little bit, and then talk about what's been published in terms of the groups. So Pamela Kriskoff's group up in Vancouver, British Columbia, she has published some really interesting findings in ketamine in a group setting. And so then we'll talk about what's happening at Riverbird and sort of who do we see here in Portland, Maine? What are their demographics? What conditions are we treating here or addressing? And some of the preliminary findings that we have. And so we have folks who are doing the individual work, and then we have our group cohorts as well. So just want to share about the structure of it. How do we do this preparation, informed consent? How do we facilitate a group medicine visit, or like what's the cohort structure? And then most excitingly is hearing from a patient who's done the group medicine work.